I'm joined by Dr. Sam Rasool, who has helped us through many aches and pains. But one of the most common that we haven't talked about, I think, maybe ever on SoFlo Health, is shin splints. What do I do about it, doctor?
So the first thing is, shin splints happen because of this muscle right here. If you notice, if you go down the middle, the bone right here, it's the outside muscle called the tibialis anterior, and this muscle gets shortened and or tightened, and that's what causes that tightness on the outside. Actually, it's easier to show on a Hunter. Hunter, go ahead and put your leg up.
Roll my pants up here.
So as Hunter brings up his leg right here, you notice this muscle, if we follow his bone just like that, it's his outside muscle right here. This actually gets tightened because of running. This can happen for a number of reasons, but regardless of the reason, when this muscle gets tightened up, you need to loosen it up. First thing you do, massaging it at home. What you can do is you take your own thumb, you're gonna put it right on the area, you're gonna find the tension area. So with you, I feel a lot of tension in this area, and you're always gonna go counterclockwise, guys, never clockwise. You don't wanna wind up, you wanna go against it. What you're doing is unwinding that tissue that's around the fascia, that's around the area. So you're just going counterclockwise, just like that. Hunter's making faces, you know I'm doing a good job as we go
Well, it's like, it almost feels like it heats up, which is weird.
Yeah, it actually does. You're bringing blood flow to the area, and you're actually unwinding that muscle tissue in there, and basically that fascia, and getting the nutrients to flow into the area.
Okay.
That's number one.
So this is something that anybody can do.
Exactly. Now, let's say you do that at home, and you're not getting the relief you need, you still go for runs, you still feel the tightness. That's when you can see a medical professional, like a sports rehab specialist, like a chiropractor or physical therapist, and they can use our trusty little tool, which we've used in the past, our Graston tool. This is a soft tissue manipulation where we're gonna go with the same concept. We're gonna find where the tension is in the muscle, and I'm just gonna kind of go in there and break up those adhesions. What we're doing is we're basically breaking up anywhere I feel like a little speed bump there. That's where the tightness has occurred. And if you can get the patient to make faces, you know you're doing a good job. And you know
that tool is the most amazing thing to me.
I tell you what, Hunter, a lot of my patients have a love-hate relationship with this tool when I use it. They hate it during, they love it afterward. But like I said, you're trying to open up this space. Now, in addition to just massaging it and of course breaking up the adhesions, a good stretch you can do at home. What you want to do is you want to put your foot into the ground, but actually internally rotate your foot just like so. So if you turn.
Almost as if like I'm rolling my ankle.
Yeah, almost as if, but don't go too far with it.
So it's something like this.
Yes, and what you're doing is you're getting that stretch right in that area. Yep, and you're getting a stretch right across right there. You're stretching that area out. But for most people, if they do this and you feel a little tightness or a little bit of restriction or pain in inside portion of your ankle, outside portion of your ankle, then you got an ankle issue, which could be why you're having shin splints in the first place.
Funny enough, when you say that, I felt the most tension right on basically the bone of my ankle. So that's probably for another time.
I think we save it for another time.
We'll save it for another time. So thank you for showing us how to resolve shin splints, both on our own and with a professional like yourself. Feel free to try the non-professional part at home.